Hello, my name is Adrian Banning. I'm a consultant cardiologist in Oxford and I'm currently the president of BCS. This January, 22nd to the 24th, is the ACI meeting in London. It's held at the Hilton Metropole. This meeting is the ACI meeting, it's the BCS highlight of the whole year, and it's where we all meet together as an extended cath lab team to discuss what's happening and what's current in intervention in 2020. This year the programme is pretty packed. We've got 3 full days of work, and I'm hoping that many of you will be able to join us in London to see and discuss some of the latest technology and some of the latest developments in coronary and structural intervention. On Monday we've got live cases from Wythenshawe, particularly focusing on imaging, OCT, IVUS, and how those imaging technologies can facilitate our optimal outcomes for patients having coronary stents. We've then got a really interactive session around some of the late-breaking trials, the ischemia trial that was presented at AHA, Excel and syntaxes. There's been a lot of debate about the 5-year Excel data, and also the complete trial, which is a trial of revascularization in patients presenting with STEMI. Should we be doing all the lesions or we should be doing partial revascularization? So that session on trials promises to be a real highlight. We've got Greg Stone coming to talk to us from New York about vulnerable plaque and the latest developments in how we diagnose vulnerable plaque and how we should be managing it. And then a debate about TAVI. Should TAVI be the optimal treatment for everybody with aortic stenosis, or should we still be selecting it for those patients at highest surgical risk? And then a session on the mitral valve. Clearly mitral valve intervention, percutaneous intervention, is slightly behind aortic valve, but in this session we're going to look at MitraClip, we're going to look at the new devices which might be suitable for those patients who aren't suitable for MitraClip, how we should be imaging the mitral valve to select patients for the right treatment, and ultimately which patients should we be pushing forward for intervention now in 2020. Wednesday ends with a traditional BCS session where we go into small rooms and look at angiograms and look at complications and learning points, and hopefully that will wrap Wednesday up into a nice bundle of education for everybody. We start early on Thursday with a session on cardiogenic shock. So cardiogenic shock is something which we all have to deal with in our cath labs, and I think one could argue that outcomes have not improved dramatically in the last 5 years. There's some debate about where mechanical support fits in. There's some debate about whether we should be having shock centres. There's some debate almost about definition. So I hope in that 1.5 hour session we can get some clarity about how in the UK we should be moving forward our therapy for patients presenting with shock. We've then got live cases from Papworth, and then a real highlight for the Thursday session, Peter Ludman going through the BCS Audit data, which will be a 1.5 hour session where we can dissect all of the data from 2018-19, look at what the trends are, look at what is happening, what's new, what we're not doing so much of, what we're doing more of in the UK, and some discussion about 7-day working, which I think is something we're all increasingly doing on a routine basis in the bigger hospitals and perhaps also in the smaller hospitals. It'll be interesting to see how that's working out. We've then got a debate about drug-eluting balloons and how they fit into our interventional armamentarium. You know, should we be using drug-eluting balloons in native disease? I think we're all fairly comfortable that they've got a role in stent restenosis, but enthusiasts are suggesting that perhaps we should be using it more in native vessel disease, and that's going to be a great debate which I look forward to very much. We've then got a session on the young investigators and the best of the young, but throughout Thursday there's also a parallel track for AHP participants where they can have a parallel programme looking at things that are specifically interesting for them, particularly around role development and how we use our facilities more effectively. Friday begins with live cases from Derby, and then we've got a sort of core educational session around dual antiplatelet therapy. There's been a lot of new data about the duration of dual antiplatelet therapy, the benefits of prasugrel versus ticagrelor, and I look forward to hearing that session in particular. There's some new drugs which we're hearing about in our diabetic patients, particularly some which were initially a diabetic drug but now seem to have a role in heart failure, and we'll be hearing about that, and a session around investigation of patients with angina but normal coronary arteries. How should we be using physiology in these patients to make diagnosis, and can we then, by making more accurate diagnoses, look to make specific therapies which might be beneficial for that patient group? We've got a session on training, and I think particularly for older people like me, trying to understand what's happening with training, what's coming down the pipe is really going to be quite insightful, I think. And then another debate about CTO. I think we all understand that there are patients who definitely benefit from CTO PCI. Perhaps has it swung the other way? Are we doing too much CTO PCI? And that promises to be an area of vibrant debate, I think, where we try and find the right level, particularly in the context, perhaps, of the ischemia trial, which I mentioned earlier. Finally, on Friday, we've got the final complications session, which looks at how we learn from unexpected events in the cath lab. One of the reasons we love intervention is we can never quite tell what's going to happen next, and certainly that complications session always has a few surprises and some interest and occasionally some laughs. So I look forward to meeting you and seeing you in London at ACI, and look forward to what should be a great meeting.